Graduates Conversations podcast.
Hi, thanks for tuning in. My name is Fatih and I'm the host of the Conversations podcast powered by All Graduates Interpreting and Translating Services. I really hope you're enjoying our podcasts. Please make sure to subscribe to our channels. You can find us on YouTube, Apple Podcast, Google Podcast, and Spotify. Now, if you have any topics you'd like me to cover, or if you have any guests you'd like me to interview, please send me an email with your ideas. My email address is fatih@allgraduates.com.au. That's Fatih, F-A-T-I-H, @allgraduates.com.au. Thanks again and enjoy today's episode. Hello, everyone, and welcome to another episode of Conversations. Today, I have with me Emiliano Zucchi, who is the Director for Transcultural and Language Services and Naran Willipgeen Aboriginal Sport Unit at Northern Health. Welcome, Emiliano, and thank you so much for attending today. How are you?
I'm well, thanks, Fatih. How are you?
Very good, thank you. Again, thank you for taking the time. I know you are very, very busy, especially during these days. I really appreciate it.
It's been a very challenging period.
Just to do a little bit of an overview for our listeners, as you would mostly appreciate that COVID-19 has impacted the way that language services are delivered in almost all settings, and that's including hospitals and healthcare institutions as well. And, you know, to be honest, it is where majority of interpreting services in our industry is delivered. And it has really affected hospitals and healthcare institutions and how interpreting services are delivered, like we were saying. And we can see a shift from face-to-face interpreting towards remote interpreting, for example, telephone interpreting and video interpreting. So we're just going to talk about that today. Emiliano, tell me roughly how many interpreters do you work with on a weekly basis? How many do you have in-house? How many agency interpreters do you work with?
So we receive approximately 80,000 requests for interpreters every year in over 100 languages. We cover approximately 80% of all demand in-house. We have a very big in-house department, 42 in-house interpreters, a combination of full-time and part-time with a couple of casuals. And the in-house interpreters cover the top 15 languages. Then the other 85 or 90 or so languages we outsource to external agencies. And I suspect it's about 310 requests per week that we outsource to external agencies. The rest we cover all in-house.
300 plus interpreters, still a lot of casual interpreters on a weekly basis.
No, 310 requests.
Requests. Well, in regards to these assignments, are they still being delivered face-to-face, or is most of them delivered through video, telephone?
Most of it is now moved to telephone. There is still some interpreting being delivered face-to-face, but I would like to take this opportunity and thank you, Fatih, for the opportunity to reassure all interpreters that we take personal safety very seriously, and that PPE is being provided to those interpreters who are required to visit the COVID wards or the emergency department or the intensive care unit. And in the last few weeks, hospitals have become a lot stricter about PPE wear, and they've extended the areas where PPE must be worn and the different type of PPE. So, as I said, it's really, I'd like to make the point that there has been some concern in the community that hospitals were not providing appropriate PPE. It's actually not the case. We do provide PPE, both, of course, for in-house interpreters and external interpreters. I think another point I would like to make, it is important that interpreters see themselves as part of a multidisciplinary team looking after the patient. To this end, if it is safe for doctors, for nurses, for allied health clinicians to be in the room with the interpreter, it is also safe for the interpreter to be to be in the room with the patient. It is also safe for the interpreter to be in that room. This is a very, very important point. We know that there have been some interpreters refusing to go into the room because they were afraid that they might catch COVID, or suggest that the assignment be completed by phone rather than face to face. But this, to me, compromises the interpreter's role and our duty of care towards the patient. If that appointment could have been delivered by phone by the clinical staff, then it would have been done by phone by everybody. So this is a very, very important point. Interpreters have to very much see themselves as part of a team looking after the patient, and they need to, they have the same duty of care towards the patient than all other team members have. So it's unfair to say, okay, no, the doctor, the nurse will be in the room, but the interpreter will be delivering that occasional service by telephone. It doesn't work like that.
You make a very valid point there, and you also say that if it's safe for the doctor and the nurse and the treating team to be there, and as part of that treating team, the interpreter, they have to be there too, and it is safe for them to be there because you're also providing all the required PPE, and they are at the highest level, like it is with other healthcare workers.
Yes.
And if it was able to be delivered with remote interpreting, it would already have been done anyway.
Exactly, like most appointments are. So most appointments now have shifted to a telephone or video, and because it's more practical for the health service to do it remotely. But if there are appointments that are still face to face, it's because those appointments are very, very delicate appointments, if you like, where it is required for the clinicians and therefore for the whole team supporting the clinicians, including interpreters, to be face to face with the patient.
And when the language services aren't being delivered face to face, do you see majority of it being delivered through telephone interpreting or video interpreting? I know recently. I know recently telehealth video interpreting has come a long way in the last few months. In your experience, where do you see majority of the work being delivered at the moment?
Yeah, look, most of it is being done by telephone, and the risks I mentioned before are real risks, not perceived risks. So the telephone interpreting, as far as I'm concerned, is not a perfect mode of interpretation. A lot of the message is lost at both ends, and therefore I would prefer video above telephone. Another point is that during COVID, interpreters are not being engaged as consistently as they would normally be. And as I said before, not many people like delivering a service by telephone. Doctors and clinicians often fail to call or to engage the interpreter, and this is at the expense of the patient with limited English proficiency, as well as at the expense of professional interpreters who are not put in a position to do their job professionally. If interpreters do not hold up the highest standard and work ethic, there is a strong risk that clinicians will revert back to using family members to interpret. For these reasons, I would prefer to see a greater uptake of video as opposed to telephone. In times of crisis like the ones we are living through now, it is essential that we move to video interpreting as soon as possible. And I think that as an industry, we need to be more, to do more so that this happens not only as a response to COVID, but also as an ongoing solution post-pandemic.
Thank you, Emiliano. And as you know, I'm a practitioner as well, and I have been working in a hospital as an in-house interpreter as well, and I definitely see where you're coming from. More and more these days, I see clinicians even now preferring to use family members, preferring to try to just get by with the patient and with their broken English and their limited English, as opposed to contacting an interpreter. And, I find that clinicians, because they're already so busy with doctoring and taking care of the patient, they don't necessarily want that extra hassle of connecting with an interpreter, going through that video interpreting or telephone interpreting technological demands and connecting people. I think there needs to be a lot of training given to the clinicians as well in regards to working with interpreters via remote interpreting, just like the training needs to be given to the practitioners as well. And I think there's a lot of work being done on that recently. Ausit just released their video interpreting protocols just very recently. So I think it's a worthwhile for our practitioners and also clinicians who are using interpreters remotely to read that and consult that. You were saying that, ideally we want to do face-to-face interpreting, but we see that more and more these days, remote interpreting is used, and in particular, telephone interpreting. I mean, what are the disadvantages of telephone interpreting, especially when you have this really almost brand new system that is now being more widely used, like video interpreting and telehealth, and still telephone interpreting is used much more? What do you think are the disadvantages?
As I said before, I think telephone interpreting is far from an ideal mode of interpretation. A big part of the message gets lost at both ends. Tone, volume, body language, and other nuances are totally lost during telephone interpreting. Moreover, if we think that we are often dealing with elderly patients who might be hard of hearing, the result is that message transfer is compromised. Now, when message transfer is compromised in the health context, in a hospital, risk increases, and the health outcomes of patients with limited English proficiency might also be compromised. This is a very, very important point I'd like to make. So interpreters should actively pursue face-to-face or video interpreting as the preferred mode of interpretation, and should insist that organizations, both public and private, only use telephone interpreting as a last resort. As I said, if part of the message is lost, it really compromises obviously the communication and patient health outcomes. And some of these outcomes are quite serious outcomes. Video has an advantage over telephone, of course, because it's visual. It's probably not as good as face-to-face. Maybe it will never be, I don't know. But it's certainly a superior means than telephone. And I sort of feel that some interpreters at the moment, maybe because of the fear of COVID, because of the concerns, which are all understandable, are really pushing for telephone. But we need to be careful as an industry that we remind people that telephone is not a perfect way of delivering the service. Far from it. because the risk is that if we don't do something about it, the risk is that post-COVID, post the pandemic, then people will say, oh no, we'll continue to use telephone. Well, no, we can't continue to use telephone because there are too many risks associated with telephone. We should only use telephone for short, risk-free appointments, and when, as I said before, when face-to-face is not available and when video is not available.
I mean, you're right. Most of the time that I've done telephone interpreting prior to COVID-19, it was more for, I guess, more basic assignments. You know, it could have been for a gas bill, electricity bill, telephone bill. You know, every now and then it would be something health related. But of course, these days it's a very, very high percentage that we are delivering very, very important assignments through telephone interpreting. And look, we also said, especially through telehealth, and there could be some other platforms as well with some other agencies. Video interpreting, we are seeing more and more of, but it's still a baby, isn't it? I mean,
Yes.
do you see it catching up anytime soon? What can be done to make sure that we push video interpreting, especially in these day and age?
It is catching up, but not quickly enough. The technology is available. The infrastructure is easy to put in place, and any initial cost will be recovered very quickly. So, as I said before, as an industry, we need to be considerably more proactive when asking that video be used when face-to-face delivery is not possible. I would also go as far as creating a tiered system, if you like, whereby we say, okay, hospitals and courts, we prioritize face-to-face interpreters for face-to-face interpreters are not available for hospital and courts. We try and do video, and we save telephone for occasions of service that are where the risk is not very high. Like if you make a mistake filling in your license application, you just fill in another form. If you make a mistake in hospital, that could have very serious consequences. So I would at policy level, I would say, no, okay, we need to prioritize the more professional interpreters, the higher qualified interpreters, the more experienced interpreters for face-to-face interpreting in hospitals and courts, and also deliver the services by video when face-to-face is not possible. Telephone can be used in risk-free contexts, and any context that is not health or legal, the risk is much lower.
Indeed. But I think also there needs to be still quite a lot of training delivered for practitioners and for end users as well in regards to using video interpreting. And I think that hopefully we'll be seeing a lot of this training coming sooner rather than later. And look, you said that sometimes we see clinicians reverting back to the old ways of either using family members or speaking to the patients with their very limited English. I mean, it's very, very risky business going back to those old times. Why do you think it is very important to have interpreting services for patients?
Look, there are many reasons why interpreting as well as translation services, not only interpreting services, but translation, transcultural training that you mentioned before, research, all these things are fundamental in the hospital context. First of all, interpreters are important, first of all, because they are a basic human right. So we all have a basic right to express ourselves in our preferred language. Secondly, we are all Australian citizens, and as such, we have a right to the same level of access and care as any other Australian, regardless of language proficiency or cultural background. Finally, research is fairly clear. The more interpreters are engaged, the greater the health outcomes of patients with limited English proficiency, and the greater the cost containment. At Northern Health, we have been able to cut the length of stay of patients requiring an interpreter by 2/3 in the last 10 years because we increased the access to interpreters. This alone contained costs by the millions. So by providing interpreters, you are guaranteeing, ascertaining a basic human right. You are improving health outcomes for all Australians, regardless of their background and or English proficiency. And at the same time, you are saving money because if obviously if the patient and the interpreter, if the patient and the clinician understand each other, there are less appointments, less diagnostic testing. As I said before, a decrease in length of stay, a decrease in readmissions to hospitals. All these things cost a lot of money that can be which can be saved. It's not really saved, it's contained. The cost is contained if language services are provided consistently. So if you think that in some areas of Melbourne you have up to 50% of the population born in non-English speaking countries, and in some areas of Melbourne, if not most areas of Melbourne, between 20 and 25% of patients require an interpreter, that gives you an idea that by investing in language services, we will recover the investment very quickly, not only from a human point of view and guaranteeing human rights, so the same rights for all Australians, but also from a cost point of view.
It's a very interesting point that you make. I mean, yes, I understand that it's a human right issue as well, but when you put it into the dollar figures, I mean, some people, unfortunately, they see everything as numbers and spreadsheets. What seems to be a cost at first, actually, when you look in the long run, is a cost-saving investment, isn't it? You're saying that because the clinician and the patient can communicate better through an interpreter or through using language services, their treatment and their stay at the hospital is shortened and is much quicker, hence saving millions and millions of dollars. Wow, I think that's a very important point to make, especially for the people who just see dollar signs, because it's their job to just see dollar signs probably.
Yeah. Look, I mentioned the dollars for a very precise reason, because as a director in a public health service, you need to be making a financial point as well as improving the services that you deliver. We were able to grow to over 40 in-house interpreters because we were able to demonstrate the cost containment by employing more interpreters. If I hadn't been able to demonstrate that cost savings, I don't think I would have been allowed to grow as much as we have.
Very good. Look, I just want to ask you a question that's perhaps a little bit off the topic. Do you think that because of the COVID-19 situation, and now that elective surgeries have slowed down, regular treatment has slowed down, do you see that this is going to be affecting patients in the long run, or the health and well-being of the population in the long run?
I think unfortunately the answer is yes. Perhaps not so much for the more urgent cases, but generally speaking, COVID has affected patients getting the usual treatment. This is very concerning. We need to encourage our loved ones to seek medical help or advice even during the pandemic. I suspect that slowing down care, not having the regular checkups with our GPs will have repercussions down the line. So I understand that a lot of people are concerned about going to see their GP or going to hospital because they have a concern for COVID, but we need to continue to look after our health, because otherwise there will be a compounding effect down the line. But I would also like to make another point regarding interpreters working from home. So a lot of our in-house interpreters at the moment are working from home. About a quarter of our workforce rotates and constantly works from home. It's really important that when interpreters work from home, that they maintain a healthy lifestyle, a healthy diet, that they do a daily exercise, and it is important because working from home means that we're not moving around as much. It doesn't seem like a lot, but walking to the car, parking the car, going to the office, returning, going up and down a million times between wards and outpatients areas. This is all a form of exercise that working from home is lost. So it's really, really important for interpreters to maintain some sort of physical activity during this period. And it is just as important to keep an eye on our own mental health. We need to remain positive. We need to be kind. We need to accept that in stressful times like COVID-19, we might all say or do things that we didn't really mean, or that normally we wouldn't do. So it's really, really important not to stigmatize mental health. If interpreters need support, there's plenty of support out there. Please, we need to recognize that if this issue is not addressed, it might get worse. So really look after yourself.
Interpreters and translators as well, we need you, so please do take care of yourselves during these hard times. Now, if you're not in Victoria, make the most of your unlimited times to exercise and get out there as much as you like, because in Victoria we can only be out 1 hour a day to exercise, and we can't go any further than 5k radius. So those of you not in Victoria, enjoy your freedom. Those of you in Victoria, make the most of your 1 hour. Get out there and do as much exercise as you can. And I know it's pretty cold these days, so make sure that you rug up. In regards to mental health, I'm sure in Northern Health there would be an employee assistance program. Yeah, and I'm sure in every other hospital too. And for those interpreters who are freelancing, don't forget that your agencies also have employee assistance programs as well. And I'm sure that if you reach out to your agencies, they will be very, very helpful in regards to that. So take care of your body, your mind, and your spirit. We will all get through this together. Before we close up for the day, Emiliano, do you see that hopefully there's a bit of a silver lining at the end of all this, and video interpreting does find its feet? I mean, do you see that we'll be using video interpreting more and more even after COVID-19 hopefully passes?
Yes, I really hope so. And I think that probably up to 30 or 40% of all interpreting occasions or service can be safely delivered by video post COVID-19. Let's not be afraid of change. Video will not substitute face-to-face. It will increase access to services for more vulnerable communities. So I know a lot of people resist change. A lot of people are afraid that video or telephone is going to replace face-to-face. The truth is that there is such a great need in Australia for interpreters that it's not either one or the other. We need all of them. We need face-to-face, we need video, and for where face-to-face and video are not available, we need telephone as well.
Emiliano Zucchi, thank you very much for your time today, and I hope to speak to you again soon.
Thank you so much, Fatih. Good to speak with you.
Thank you. All the best.
All Graduates Conversations Podcast.